Uh, Hello everyone, I am Dr. Vipin. I am from Kerala, India, and I am working in Almaty, Kazakhstan. This video is to share my feelings and uh, my story about I clearing my Part 3 MRCOG exams. When I say that, I feel so happy, and I want every one of you to feel happy like this after the exams. It's really an emotion, really. And let me tell you one thing: if I can pass, anybody if you can pass. And see into my eyes, you will realize I say this from my heart. Of course, we need to learn a lot of things and we need to know a lot of things about the exam, which we do in part 2 examination. So if you have cleared part 2, you have the knowledge, right? This exam is only about practice and the heart to give this exam. So that is what is needed in this exam, and this is what I was feeling in after clearing my part 2. I had so many doubts what to do, what to do actually. And that time Dr. Abu suggested me that should not have any second thought about it, just go for Dr. Siddhar's course. And here I am today sitting and sharing my feelings with you about being one of the successful candidates. So as far as preparation is concerned, I don't have to tell much because you know everything. So many people in so many groups are talking about these things. I just want to tell you that uh, the time, or what do you say, the knowledge doesn't matter. It matters, but it doesn't matter to the extent that is required in part 3. Part 3 requires determination and practice, and one hand to hold you to tell you this is what you have to do and this is what you don't have to do. And that makes the most important part of learning while preparing for part 3. And this is what mentors and courses do. While I selected Dr. Sidra and the RFA tutors, the first day itself, I had no doubt that they are going to give their best. And let me tell you, when I was appearing for my exams, all the 14 stations, when I used to jump from one station to the another, online of course, in those 2 minutes gap time when we read, I just used to memorize those words, those she used to speak, those classes she used to have. And when I speak to the patients, that itself comes out from her mouth. So the good thing about her is, I don't know how she does this, is she murmurs into our ears when we are appearing the exam, and we tell the same, exactly same words what she wants us to tell. And the examiner is of course happy because of that, because we tell the things that is required. And that is one thing I admire about her. Coming to her team, such a dedicated team. I don't know how night 2 o'clock, whether morning 8 o'clock, afternoon, whatever time it is, you message some queries and 2 minutes, no 2 minutes, in 30 seconds the reply comes back. This is the thing. So many mnemonics, so many notes, so many things they share. And I think if you go through those, that's enough to just clear this exam. uh, as I said, I prepared this for 6 weeks. As I said, time is not very important. I prepared for 2 hours a day, but those 2 hours were only for this, 2, sometimes 3 hours. Uh, I'm an average student. I never thought I will clear. I had a lot of emotion breakdowns and loss of faith on myself that I'm not studying properly and I may lose this. But then after I clear, I understand this exam is all about having confidence in yourself, having faith in yourself. And this mentor, Dr. Sidra, she doesn't only teach you, she is with you. She holds your hands and tells that I am with you. Just go and give the exam. And this happens. This may be God's grace, but yeah, that's what happens. So you should not have any second doubt thinking about what course to go on and what to do. Just follow what the mentor is telling you to do, and just that will really help you out. And one more thing I will just like to add is, from my side, is that what I liked most about this course was two things. One is the WhatsApp group. Though I am a silent listener, as I said, I don't participate much in academic things, but the group, so much things are shared. If you take 30 minutes in a day and just read those messages, you will pass half of the stations. And second thing is about the library. My God, this course has so extensive library. It has everything in it. If you want, I practice because if I have a station, I have to have patient's concerns in my mind, right? What the patient will ask. I have to just go through the template that is there in the library. Every patient concern answered is there in the template. So it makes very easy for us to learn. For a person who has a lot of work to do, like most of us has, our busy schedule, family and all, that is the best thing I would like to tell you about this course personally. As far as I am concerned, as I said, if I can pass, anyone, if you can pass, I'm really telling you, I had to shift countries, I had to work till the day of exam, on the day of the exam, and still I cleared it because of my mentor, Dr. Sidra, and this course. And I tell it from my heart, bottom of my heart. Thank you all for supporting me clear this exam. Clearing this exam really means a lot, and it will really mean to you all also. So all the best to all of you guys, and clear it in the first go. Thank you.